welcome to this panel on lessons learned for local democracy during the COVID-19. This session is the 2020 Local Democracy Academy, hosted by the Swedish International Center for Local Democracy, and it's also an event of the Cities Are Listening experience, facilitated by United Cities and Local Governments, Metropolis, and UN Habitat. The Cities Are Listening experience marks the way towards the implementation of the UCLG Decalogue for the COVID-19 aftermath, inspired by the lessons learned from our membership during the outbreak and by how local and regional leaders envision the future. Precisely, last June, we hosted a live learning experience on local democracy. Now, let me share a couple of practical notes about these sessions. All participants are invited to share comments and questions through the chat, which you will find in the menu on the bottom of your screen. And the moderator will later select some of these questions. Also in the menu, you can find the translation icon in case you need to activate it. English, French, and Spanish translations are available. So thanks to all for joining us today. And now I give the floor to the Secretary General of UCLG, Ms. Emilia Saiz.
Thank you very much, Adrià, and thank you to the Swedish International Center for Local Democracy for inviting us to participate in this year's Local Democracy Academy. It is a great pleasure to do that. And as Adrià was saying, during this very special year, we have been meeting together the constituency of local and regional governments. Since March, we have been holding exchanges on how we are going through this very particular moment that humanity needs to face. And starting in September, we thought we had to shift a little bit from sharing of experiences to more strategic thinking and forward-looking thinking. That is what we want to do with Cities Are Listening. We also thought that since the transformations that we will need to involve many different stakeholders, we needed to ensure that the dialogue with those stakeholders was put more upfront in our exchanges. And the other thing that we want Cities Are Listening to ensure is that we stimulate policy changes, that we stimulate policy shifts, that we decide and influence on each other's agenda. That is the space that we are offering as United Cities and Local Governments, Metropolis, and UN Habitat. And we are very happy to tackle this topic. Democracy, not only local, at all levels, has been challenged for quite a while. We all know that we have been discussing about the governance deficits that our world was facing. And during this pandemic year, where decision-making at public level has become so critical, and where the defense and protection of the commons has become such an important topic in our daily lives, this discussion becomes even more and more relevant. I'm not going to go into the content of these discussions because I will be intervening later on, but I just wanted to frame this. Please don't take this as one more webinar where we are just exchanging visions. See it as a planning and policy development exercise that starts here, but that will be shaped further as 2021 goes on. I would also like to thank the active participation of our International Observatory on Participatory Democracy, which UCLG hosts, for the inputs and for their involvement in helping us rethink and reshape democracy. So thank you all. Welcome also on behalf of UCLG, and over to you, Ana Maria, to guide us through the rest of the session.
Thank you, Emilia. So welcome to this panel on local democracy and COVID-19 lessons learned for 2021. My name is Ana Maria Vargas, and I'm the Research Director of the Swedish International Center for Local Democracy. And I have the honor to be the moderator of this panel. The coronavirus has impacted citizens all over the world. While some governments are using the coronavirus as an excuse to impose top-down policies and enhance authoritarian powers, many local governments are making democracy a key part of the response to the challenges posed by the COVID-19 pandemic. While COVID-19 is not over, we hope that this crisis can also represent an opportunity to learn about how to handle future crises, and also to rethink many issues of citizen well-being, the conditions of elderly care, the environment, the use of technology, and most of all, the role of local democracy. So this panel will mainly discuss lessons learned from the COVID-19 and the implications for democracy, thinking forward. We hope that at the end of the panel, you can make your own 2021 wish list to improve local governments, and as Emilia said, to move forward. With this background in mind, I have the pleasure to introduce you to our very competent group of panelists. They all have long experience with local democracy, but they do represent different points of views, which will enrich our discussion. So let me introduce our panelists. And with us, we have Anders Knappe, President of the Swedish Association of Local Authorities and Regions. We have Imen Ouardani, Vice Mayor of the city of Sousse in Tunisia. Emilia Saiz, Secretary General of United Cities and Local Governments. Professor James Maynard, Professor Emeritus of the School of Advanced Study, University of London. To pose questions to the panelists, please use the chat. We will address a number of questions from our audience from around the world towards the end. The panel will have a total duration of 1 hour. So let's start. I would like to pose the first question to you, Anders. As president of the Swedish Association of Local Authorities and Regions, Sweden is a country with a high degree of decentralization and strong local governments with power and resources. However, the extraordinary situation of the pandemic has been used by some to argue for re-centralization. I want to ask you, Anders, what are the lessons learned for self-governance and the role of local governments for future crises?
Thank you, Anna, for giving me the opportunity and the chance to be in this seminar. Thank you so much for that, and also to UCLG. First of all, I think we have to look into the Swedish constitution. It perhaps sounds boring, but there are some very important elements in the Swedish constitution that explain something of what's happening in Sweden. Because I know Sweden has, as an example, been debated all around the world. The first thing in the constitution is that it's guaranteed freedom of movements for Swedish citizens, and that rule out national lockdowns. You can't make a national lockdown in Sweden with the current legislation. That's not a chance. And the second thing is establish unique independence for public authorities and agencies, allowing them to design the policy response to the pandemic. And the third grant, it's exceptional power to local governments, the unique system in the Nordic countries with a high degree of self-governance. So I think this combined has shown us very clear that we have a legislation whose only is talking about what the government and what we can do when there is a war going on, but not a war against pandemic, a military war. And that means that most of the Swedish legislation that we are using in local and regional and national level is a sort of sunshining legislation. It's made of the sun is always shining, so there is no problem. So please deliver with high quality, whatever happens. Except if there is a war, because then we can change a lot and give a lot of power to different authorities, government, and even more power to local and regional authorities. So I think it's important to have that background. If you on top of that put that local and regional authorities in Sweden take care of more than 75% of the public service. And that means they are responsible for all healthcare, all elderly care, all education up to university level, all children care. So that means that all these all these services that are delivered, you can nearly say is delivered by the local and regional authorities in Sweden. And that means, of course, that they are in the forefront, and I know they are also in the forefront in other countries. But the possibilities for the national level to intervene, to interfere, I think is better or bigger in many other countries than in Sweden. So what consequences have we seen out of that? We have 290 local authorities, we have 20 regions, and as I said before, they are responsible for all these different things. The regions are not only responsible for healthcare, they are also responsible for public transport. And public transport has been a very important part when we talk about the situation during the pandemic. What we have seen is that, as I said in the beginning, the Swedish legislation is not up to date in the sense to handle a pandemic, because we have to take decisions in hospitals, in intensive care, in schools, in elderly care centers and things, and also in the delivery of social welfare. That means that we have to start to make priorities. And this is not foreseen in the legislations so much, that you should make priorities between people. Everyone should be equal treated, everyone should have the same possibilities, everyone should have the same chances. And that means that when we have a situation when we, for example, double the intensive care beds in the country in a few weeks' times, double it up. When we want to lock in people in elderly care who don't understand that they are infected and that can infect others, we are not allowed to do that. We are not allowed to do that. We are by the law. And when the local authorities start to do things like this, then the state agencies come in directly and say, you are breaking the law. You are taking positions and decisions that are against the Swedish legislation. And the local authorities and the regions try to say, but we don't have resources at the moment, and we want to do things because we want to save life and so on. But the understanding, I must say, on national level has not always been as big and good as we want. And of course, they have to refer to, there is a legislation saying you should do this and this and this, and it doesn't talk about the pandemic, this legislation. So please deliver. What the government have tried to do then, that is to put in enormous amount of money to local and regional authorities. That means that we will have the highest surplus in history in local and regional authorities this year in Sweden. It will be around 4 billion euros, 4 billion euros, the surplus in the sector, because we can't use the money, because we don't find more doctors, we don't find more nurses, we don't find more people to put in the system. And we don't deliver in a lot of things because we can take a decision of closing down a swimming pool or closing down a library or closing down other things because we are responsible for all of them. And then we save money in a sense when we don't have it open. So there is it's a very, very strange situation at the moment, that we are overfunded in a way. We can levy income taxes, local and regional authorities in Sweden levy income taxes, but we have got so much state grants during this year that is much more than my association even ever have asked for, much more than we have asked for. And this make it also complicated on the local and regional level in the relation with the citizens, because they say, but you have so much money now, please help me, deliver this, do this, and do this. But we can't find and the resources to do everything that people want us to do. Because if we say to people working in hospitals, if we say to people working in elderly care, if you feel a little bit of a cold, or if you feel a little bit of a fever, if you feel anything strange, don't go to work. Don't go to work. And so they stay at home. And we can't find new people. We are trying to take in students from universities, in medical students, nurse students, retired people. We pay them very well, whatever, to find people, because a lot of the working force stay at home, because there has been so clear signals from the national level: stay at home if you don't feel okay. The other thing I just want to mention is the function of the democratic system. It has learned us to have meetings like this. Absolutely. It has learned us to have meetings and even vote in the meetings and debate in the meetings and so on. But people are so tired of this. They are so tired of this. They want to meet, they want to have the traditional council meetings, committee meetings, meetings for decisions, and so on. And it's working, but it also have learned us that we have to change some of the legislation concerning the possibilities to have meetings like this, to fulfill democratic requirement. And some of the meetings that are held today, I'm not sure that they are 100% in accordance with the current legislation. So we absolutely have to look over that. To finalize, there is a lot of experts now saying, but you have failed in that field or that field or that field. Let the state take over. But if you look who is saying that, it's a lot of people who are not working in the sector. They are very well, they know everything about the pandemic. It's very strange. They even know more than the professors. And we also have always a debate in Sweden about what should be local, what should be regional, and what should be national. We have the Liberal Party, for example, they have always fight for the state should take over the school. And of course, now they say, you can see here during the pandemic, there is a need for the state to take over the school. The Christian Democrats have always said the state should take care of the healthcare system in Sweden. Now they can say, yes, you see here in the pandemic, you have to put it over to the state. I'm sure in the long run, it will not change most of the division of power in Sweden. It will not change much between what we are responsible on local and regional level. But we will learn to cooperate better. We will learn to have more plans for handling situation like this. We were not as good as we should be. Thank you so much.
Thank you, Anders.
I hear your voice. I understand I have to finish now.
No, I just think that it's really excellent. You put us a little bit on two sides. On the one hand, you tell us that Sweden local governments have too much money and they don't know what to do with all that money. So you're probably making other governments a little bit jealous and say like, oh, these Swedish people, their problems are so hard that one of them is to have too much money. But on the other hand, this pandemic have taught us that it's not just about money. It is about coordination, as you said, about having the right resources. And the resources are not only economic resources. I want to give the word now to Imen Owardani. She is the vice mayor of the city of Sousse in Tunisia. And we said that one of the premises of local democracy is that citizens are close to the decision making, and this makes easier for local politicians to respond to their needs, but also for citizens to hold them accountable. So you are a local politician, and we would like to ask you about advices to other local governments. How can other local governments keep being accountable to the citizens, keep being listening to the needs of their citizens in future crises like the one of the COVID-19? Thank you, Imen.
Merci, Anna Maria. Tout d'abord, je veux réitérer mes remerciements au Centre international suédois pour la démocratie locale ainsi que la CGLU pour de m'avoir permis de participer avec vous à ce panel fort intéressant, tout comme les autres rencontres et panels précédents. Donc, c'est toujours un honneur et toujours avec un immense plaisir que je participe à ce genre de rencontres qui seront qui sont un espace d'échange sur de bonnes pratiques et de partage de savoir-faire. Comme vous venez de le dire tout à l'heure, c'est pas toujours une question d'argent pour surmonter les crises que nous sommes en train de confronter à nos jours. Tout d'abord, j'aimerais bien mettre l'accent sur un point, c'est que si on veut construire des villes durables, on doit impérativement repenser une gouvernance efficace, inclusive et ouverte, et aussi qui garantit l'égalité des droits et des chances afin de rendre la population pleinement actrice de leur existence. C'est dans ce contexte-là, j'aimerais bien partager deux petites expériences qui ont lieu durant la pandémie du Covid-19 pour mettre l'accent sur l'importance de la démocratie locale pour le développement de nos villes. La première expérience, en fait, ça a concerné l'accompagnement et le soutien des migrants dans la ville de Sousse et dont les organisations de la société civile a joué un rôle prépondérant à la réussite de cette action. J'aimerais bien faire toujours le lien avec l'approche participative parce que là, d'un côté, cette crise qui nous a impacté énormément, notamment sur le plan financier et économique, cette pandémie nous a permis de prendre conscience d'un certain point, notamment l'importance de la participation active des citoyens et aussi de la révolution du numérique, l'importance de la digitalisation pour le développement de la ville. En fait, en ce qui concerne donc, la participation citoyenne à la ville de Sousse, il y avait un élan de solidarité énorme qui s'est manifesté auprès de la société civile à Sousse. Et c'est pour cette raison la ville de Sousse a initié une action qui est unique et pilote à l'échelle nationale. Elle a initié un programme de soutien et d'accompagnement des migrants et des réfugiés et des demandeurs d'asile. Ce comité-là, les organisations de la société civile ont joué pleinement leur rôle en tant qu'acteurs, acteur principal du développement de la ville et de relance. Aussi, j'aimerais bien mettre l'accent sur, sur l'importance de l'approche démocratique que malheureusement là, nous traversons quelques difficultés, et notamment aussi par rapport à la décentralisation, parce que comme vous le savez, donc, ces deux approches, ce sont de nouvelles approches pour la Tunisie, puisque ça a été voté au sein de la Constitution et aussi dans le Code de collectivité locale de 2018. Donc là, on est en train d'apprendre la démocratie et d'expérimenter la décentralisation. Et là, les municipalités fait face à plusieurs difficultés et fait face à plusieurs défis dans ce sens. Donc, pour revenir à notre approche participative, j'aimerais bien aussi rappeler que pour ne pas voir le mauvais côté donc, de la pandémie, il faut voir il faut dire que la société civile et même le simple citoyen a beaucoup participé dans la relance, que ce soit donc, notamment sociale, pour ne pas dire économique, parce que c'est un peu donc, délicat dans ce sens. J'aimerais dire aussi que nous continuons à travailler avec les organisations de la société civile, mais avec un autre esprit, parce que là, nous considérons que la société civile doit être vue en tant que partenaire stratégique, générateur d'idées innovantes et non pas un simple agent d'exécution. Nous sommes convaincus qu'il faut développer davantage et de créer de nouveaux types de relations avec la société civile pour garantir une participation active de ces derniers. Également, donc, il faut continuer à adopter une approche multipartite et partenariale en lançant le dialogue avec toutes les parties prenantes. Donc, autrement dit, en collaborant étroitement avec entre autres avec les acteurs gouvernementaux, non gouvernementaux et incluant le secteur privé et les universités, ainsi que les lieux cultes. Aussi, on trouve que c'est très, très, très important dans ce contexte-là de développer davantage les collaborations intercommunales pour affronter les catastrophes. Notons par exemple le cas de la ville de Sousse qui a formé ses agents municipaux sur l'enterrement des victimes du Covid, et elle a bien sûr invité toutes les municipalités voisines pour profiter de cette formation. Aussi, il est important de coopérer avec non seulement des villes tunisiennes, mais aussi des villes étrangères et des organisations internationales dans un contexte de solidarité internationale pour qu'on puisse surmonter donc, cette crise sanitaire et aboutir plutôt à des villes durables qui respectent donc, tous ses citoyens et assurer l'égalité des chances et l'égalité de genre. Merci beaucoup.
Thank you. Okay. Thank you, Imen. You taught us a few issues, such as the importance of solidarity, the importance of participation, and the role that the civil society and citizens took in your city to help each other and to take care of some of the vulnerable groups. But you also reminded us that democracy is not just about asking civil society and citizens to do the work, but also listening to their needs. And I want to introduce now James Maynard. We know that COVID-19 had brought an increase in poverty and inequality worldwide, and we are facing one of the deepest economic recessions of our time. So I would like to ask you, James, now, you have followed closely the responses of local governments in England and India during this pandemic, and you are also an expert on local democracy. In your opinion, in reaching vulnerable people, what advantages do local elected councils have? And how can they use those advantages to bring back trust to the government, particularly for vulnerable groups? And you have to unmute yourself.
Now, can you hear me?
Now, yes.
Good, good, okay. This is a complicated question, and I will just touch on a couple of important parts of it. In facing the COVID crisis, which poses a threat to economies, but also to life, elected local councils are a valuable resource. But and I'll explain why, but they are valuable resources which have sometimes been ignored by unwise political leaders in several countries. And I'll just give you two examples of their value as a resource. First of all, I think we all know this. I mean, elected local councils have local knowledge. They know every street in their town or village. They know where the poor people live, where the not so poor people live, and where minorities live, and vulnerable groups live, and so on. Now, if you do not take advantage of the local knowledge that the councillors have, if you over-centralize your response to the coronavirus, then this is dangerous. And we see it both in industrialized countries and in less developed countries. In the United Kingdom, our government gave the test and trace system to a private corporation with no experience in this field, running a very centralized operation, a private corporation headed by close friends of senior politicians in the government. And this private corporation has made many disastrous efforts, so that test and tracing in the United Kingdom is one of the worst in the world. They ignored the local council's local knowledge. They ignored the fact that local councils could tell them where the needs were greatest in their towns, where the most vulnerable people were. And as a result of this, people have been dying unnecessarily in the United Kingdom. In India, something similar has been happening. The government, again, gave a contract to running not only testing and tracing, but some of their responses to the COVID-19 crisis to a major corporation with no experience in the field, whose proprietors are generous donors to the ruling party. This company had no local knowledge, and it has performed poorly, not surprisingly. That radically centralizing top-down government ignores India's very strong local councils with their local knowledge and their capacity to get help to the right places, get test and tracing to the right places. And as a result, people have been dying unnecessarily. This important local resource, local knowledge has to be understood. And a second resource, a second valuable thing that local councils have to offer, there are others as well. A second one is their ability to encourage trust between citizens or ordinary people and the medical services. This is very important during a pandemic. It's especially important in less developed countries, but it's also sometimes important in industrialized countries where, for example, large numbers of Americans don't really want to be tested or traced or to go into testing and tracing because they think it's somehow an affront to their liberty, or they don't want to take vaccines because they don't trust doctors, they don't trust scientists. Now, in countries like this, local councils can encourage people, especially poor people, to overcome their fear and their distrust of medical professionals. I've seen this myself in Indian villages. People are afraid of doctors and nurses because doctors and nurses wear strange white coats. They carry needles and other equipment, and it's very odd and a little bit frightening. And so they tend not to trust them. And we have seen in India, in parts of the country where local councils are strong, elected members of the local councils, who are people just like their neighbors, especially women elected members of local councils, have often persuaded people, especially, again, poor people and especially women, to trust medical professionals. Now, this is extremely important because in India and in many other countries across Africa, the main gatekeepers between the household and the medical services are women. And you need to persuade women that it's a good idea to take their kids to doctors for postnatal treatments, for inoculations, and that sort of thing. And in fact, because of local democracy, more women in India have taken up important health services. Therefore, diseases have been prevented and deaths have been prevented. And I've seen this not only in India, but in Cambodia and in certain parts of Africa where local democracy is strong. But the blindly over-centralizing governments in the United Kingdom and in India, and I'm sure in some other countries, are wasting this resource, the capacity of local democracy to create trust. And of course, the local knowledge of local democracy. People are dying as a result. This is a serious matter. Thanks.
Thank you, James. And you're showing us another side as well, and it's the side of trust in the medical profession. This is something that it will be key for the recovery and the aftermath of the COVID-19. So if we were to use vaccines, we're going to need to trust those doctors. We need to trust science as well. I want to give the word now to Emilia. And you, as Secretary General of the United Cities and Local Governments, you have organized more than 18 live learning experiences with mayors and local politicians from municipalities in all our continents. We have seen in these debates how local politicians from different cities shared their different approaches as the struggle was unfolding. So I want to ask you, Emilia, now, what is the importance of adaptation and permanent learning for local governments to renew this social contract with their citizens in a post-COVID world? Please.
Well, thank you very much, Ana Maria. And I have to confess, I'm finding this discussion extremely interesting because all the different perspectives seem to go to a very same kind of concern, which is what that does actually democratic governance look like? What does it need to look like also for the future? And some of the interventions that we have seen, if I go back to the intervention of Mr. Knappe, it shows us that we cannot solve big governance issues just with one type of support, in this case financial, and also not short-term solutions. The kind of shift that we will need to look at in democratic governance will need to be long-term, it will need to be strategic, and it will need to involve many different types of stakeholders. And we need to acknowledge the issue of proximity that James Manor was referring to, valuing local data, valuing local knowledge, etc. In terms of why is it so important to exchange experiences, I think it has different dimensions. It's about being inspired, inspiring each other. It is also about forming a community, having the sense that you belong somewhere, that many others are going through things like you are. But it's our greatest challenge as a global network of local and regional governments is to create collective learning. And that's the final aim. So yes, you want to create this community, you want to inspire each other. There is no one size fits all solutions. Nobody can just apply whatever they hear, but you can create a collective notion of things, of innovation, etc. And I think that is extremely critical for the topic that we are dealing with. We have covered issues of lack of trust. We have covered issues of not being able to have enough participation. We have covered the importance of involving different types of stakeholders, and yet in the research that we have been doing as the pandemic went on, we started to work on emergencies governance initiative together with the London School of Economics. UCLG and Metropolis have triggered this partnership, and we have done research over the past months in 57 different types of local governments in 37 different countries. It's funny to see how the issue of participation of people and the issue of the democratic value and trust with the citizens is not the highest in their concerns at the beginning of the pandemic. As the pandemic goes on, then we start looking at other issues. But mostly what is concerning us now is the administrative aspect of this. And it's a lot in reference to what Mr. Knappe was saying. They are concerned about either having too many competencies they cannot implement because they lack the resources, or having too little competencies, or not being consulted at all. And we are before the paradox that in places with a very high level of decentralization, like the country where I live in, for instance, there is a lot of cross information about how useful this is. In fact, citizens have a sense that maybe it would be better if there was one single solution for everybody and not different types of solutions in different territories. If you look at the concerns of local and regional governments, they identify these challenges related to administration, in particular because of the technical management and the type of innovation that they need to implement. They often don't have the legal frameworks to implement the type of things that they would like to implement. They also relate to public finances. Very often those are insufficient. They are receiving a lot of support now, but they didn't get it in the past. So they couldn't put in place the systems that would support this. I mean, you cannot start training health workers now. You would have had to do it before, and you would have had to have more competencies over the healthcare than local authorities usually have. It's also related to online resources and online procurement and online public administration in general. Even if you have the systems, very often you are surrounded by a legal framework that do not allow you to do these things online. They also have issues with how limited the possibility has been for the citizens to actually take a role in policy making. I mean, they have been able to call citizens to get involved, and the overwhelming reaction of citizens around the world has been very positive, volunteering for many things. Different stakeholders have played a very important role in facing the pandemic at the front line, but at the end of the day, the actual decision-making has remained in the same spaces where it was. And very often the different spheres of governments have overlapped decisions. So allow me to finish with another thing that we feel is extremely important, and that we need to face as representatives of local and regional governments. We need to do some self-critique. There has been a high politicization of emergency response in many places of the world, and this is for the global south and global north alike. It has created a kind of lack of political stability. And of course, in the spaces where there was that political instability, this has become more acute. And the lack of municipal autonomy has become very clear in most parts of the world. And finally, the underrepresentation of vulnerable groups in decision-making spaces has been extremely critical. And it is something that we will need to face. Like Anders Knappe, I agree that probably our priorities and division of responsibility might not change drastically, but I think the spaces of dialogue and decision-making will need to change, and the relationship between the healthcare system and the rest of the local public provision will also need to change. And that might then, Anders, shift the priorities a little bit, at least in a very big part of the world. So there is where we are. I think these dialogues are extremely important, and my hope is that what we are triggering is collective learning and policy shifts. So I leave it there, but thank you very much for this interesting opportunity. Looking forward to explore further how we can trigger some collective learning.
Thank you, Emilia. And we have now a little bit less than 15 minutes for the panel, and we have a lot of questions from the audience from different parts of the world. So I'm going to invite the panelists. Now you have the opportunity to make a kind of a statement and present your bigger point of view. Now I want you to be very brief, in less than 30 seconds, to go ahead and answer the questions that I will bring. And the first question is for you, Anders. And they ask here, one of the participants asked, so in Sweden, you didn't have mandatory lockdowns. How did local governments ensure social distancing? Can you give us like 3 short, quick things that local governments did to help to promote this social distancing?
Yes, one is that they are hiring people who stand in shopping centers, in other places, and try to organize queues and things like that. The local authorities are taking in this staff, where we have the bus queues for public transport and so on. People are standing there now with yellow vests and things like that, and try to organize it's as safe as possible. But of course, the most information is the information you send out. You send out by advertising, you send home to people, you have in different medias and so on the message also from the national level. The national level are very active in this. So it's a combination of a lot of things.
So are citizens abiding? What is your opinion? Are they following?
Yes, they were following very close during the spring. And then the situation changed dramatically during the summer because there was very little of new cases. And then it started the second wave. And in the beginning of the second wave, there were much bigger problems than during the spring and the beginning of the summer. But today I think people are really aware. And if you look around, they are much more careful. You don't find people as you find months, 2 months ago in shopping centers, in different places as you had. So I think they are more aware today, yes.
Yes, thank you. I think that we see we cannot just sit down because the COVID is still with us. This goes to the next question. And I have asked one of the participants that posed the question to say it out loud. Joseph, are you there? And if you might to unmute yourself and put your camera on so we can see you. Not sure if you are there. Let's see if Joseph is there. Yes, can we see you? Please put your question briefly to the panelists.
My question is that in Kenya, it's by law that we have public participation, or what is called citizen participation, in all development projects. And since COVID, it has been difficult to do this. Hence, we have, since the COVID started, it was difficult, and access to internet is also limited to very few places. So it cannot be done online. It must be done physically, and because of COVID, it cannot be done. So how else can we do this so that we don't endanger other people's lives as we have this citizen participation? At the same time, we guard against the spread of COVID. Thank you.
Thank you, Joseph. I would like to ask Imen to reflect this quickly. So there are countries where this is not happening. Citizens are not allowed to participate. What can we do?
Merci. Anna. En fait, pour nous, à la municipalité de Sousse, il y a quelques jours, nous avons donc commencé les réunions par rapport au budget participatif. Donc, nous, à Sousse, comme je viens de le dire tout à l'heure, donc nous avons pris conscience de l'importance de la digitalisation pour renforcer la participation active citoyenne. Et nous avons, par exemple, profité des réseaux sociaux parce parce qu'en Tunisie, donc, la plupart des citoyens utilisent beaucoup, par exemple, Facebook. Et dans ce contexte-là, donc, on a diffusé toutes les réunions donc, en ligne. De plus, nous avons reçu des questions et des propositions en ligne. Nous l'avons transmise à Monsieur le maire pour qu'il puisse répondre à ces différentes questions et à ces différentes propositions. Donc, je pense que la révolution du numérique est très importante et pour donc, renforcer la participation citoyenne. Et là, donc dans ce même contexte, nous, la mairie de Sousse, nous avons commencé déjà à changer nos priorités, comme l'a dit Emilia, après le Covid. Donc, tout a changé. Donc, nous avons gardé toujours la même vision qui est autour d'une ville intégratrice, innovante, attractive, mais nous avons changé les priorités. Parmi nos priorités, c'est la digitalisation. Et là, nous sommes en train de numériser quelques services municipaux. Nous sommes en train de travailler sur la numérisation de quelques services en ligne parce que nous sommes conscients et nous sommes convaincus que ces outils digitaux donc, joueront un rôle très important pour que le citoyen puisse participer dès la conception, dès l'élaboration donc, de ces budgets jusqu'à la réalisation. Aussi, donc, nous essayons là d'essayer d'alterner entre les réunions, donc, puisque là, on doit toujours respecter les décisions du chef de gouvernement et donc on alterne entre des réunions en ligne et quelques réunions donc, en présentiel avec un nombre restreint de citoyens. De plus, nous sommes en train d'utiliser donc les radios afin donc de créer ce lien avec les citoyens. Nous sommes aussi donc on a vu que les citoyens pendant le Covid commencent à s'intéresser à la vie publique et du coup on reçoit plus de citoyens chez nous à l'hôtel de ville qui s'intéressent à des sujets bien précis. Et donc, je pense que là, nous sommes sur la bonne voie et nous essayons de nous miser sur le numérique avec, bien sûr, toujours avec nos moyens de bord. J'aimerais bien aussi souligner que nous sommes en train d'utiliser le numérique dans, par exemple, les services, notamment la propreté. Donc, par exemple, avec nous, il y a un sous-traitant privé qui a mis en place, toujours sur Facebook, une page, une plateforme pour évaluer le rendement de cette société. Donc, nous essayons, donc il y a beaucoup de travail à faire, puisque là, donc, comme vous le savez, donc, là, on est face à une crise économique et on essaie de faire avec nos moyens de bord. Ça n'empêche que nous sommes en train de postuler sur beaucoup de projets concernant la digitalisation et de chercher de renforcer nos partenariats avec les villes jumelles ou bien avec des partenaires, donc, notamment la CGLU aussi, donc, pour renforcer donc, la digitalisation au sein de la mairie. Merci.
Thank you, Imen. Wonderful to hear about this. It's actually an opportunity that we have a big problem that has affected all citizens, and they realize also the importance of their governments of being able to voice their needs. So if we see citizen apathy before COVID-19, we perhaps are seeing some kind of citizens re-involvement in government issues. We have 5 minutes left, and we have still lots of questions from the public. I will try to bring a couple now. One of them was from Johanna Kekelame, and she asked about the role of traditional healers. So we're talking about the post-COVID and people not trusting entirely the vaccines or like this Western medicine. Does any one of you in the panel would like to say a few words about how can we work together with traditional healers? What is, in your opinion, the role? Please. James.
We have a disaster in the making in India because Ayurvedic doctors, many of whom are quacks, are now being given the right to perform surgery by the current superstitious Hindu extremist government in India. And they are also being given a role in dealing with COVID, which they are completely unable to fulfill. So although traditional healers may be positive force in some places, it's something to be very careful about because it will cost people's lives.
Thank you. I have to say also I have an experience from the Amazon in Colombia where I'm from, but they were actually really quick, and there was the only medicine that people have was access to the traditional medicine. And they were also very afraid of going to the doctors there because they said, once you go to the hospital, you never come back home. And that was the case for many. So I guess we need to establish a dialogue as well and partnership. I want to end, Anders, yes, you want to say something?
Yes, I just want to say that I was listening very careful to what James was saying, and very interesting to listen to the examples you show. But you know, at the moment in Sweden, when we are going to starting the vaccine campaign after the New Year's Eve here, the national governments are talking, but because it's the regions who are going to handle the whole thing. But they are talking about, you know, we are a people that are used to vaccine, and we take vaccine when for the first day in life, and we take vaccine the whole life, and we go everywhere to don't get the flu and everything. But I think the situation will be a little bit different this time, because there are hesitations. There are people who wants to wait because they want to see what's happened with the one who takes it first. Some people will say, I continue to keep distance instead. I only go to the grocery once a week, and so on and so on and so on. So I think we will have much more resistance for taking this vaccine that we have had before. The view of the government is the complete different. Everyone will take it because they understand this is a life insurance, but I'm not sure. So I think we will also have these problems in countries where we have a tradition of a very high attendance to vaccine and these schemes. Thank you.
Thank you, Anders. I think you make an excellent point. This is going to be a challenge that we will experience in 2021. We have 1 minute left, and I want each of the panelists to say one thing that should be on the wish list of local governments for 2021 from the lessons learned from COVID-19. And I want to start with Emilia. What is this one thing that has to go on the wish list?
Yeah, a structural dialogue mechanism with other spheres of government. No one has the results, the solutions. We need to create a different table where we all sit together to make those decisions.
Sitting together, conversations, keeping that conversations. Imen, what is your one wish for the local governments 2021?
Merci. Alors, moi, d'après tout ce qui s'est passé, je dirais aller seul. Donc, seul, on peut aller un peu vite, mais ensemble, on peut aller plus loin. Là, mon souhait, c'est de réussir grâce à tous ces efforts qu'on a déployés avec la société civile, réussir à continuer et à garantir cette motivation donc, de ces derniers et de réussir à aboutir à une ville durable et une ville qui, je dirais, qui réussit à réduire les inégalités qui vraiment sont... qui s'accentue de façon donc horrible, et là nous sommes en train de travailler là-dessus, et c'est vraiment mon seul souhait, c'est de pouvoir réduire cette fracture territoriale et réduire les inégalités.
Thank you, Imen. So I hear Emilia said more conversations, you said together and reduce inequalities. Anders, please.
I could have such a long list, but what I think we have learned during this time, this pandemic so far, is that we need more relations, cooperation between local authorities and between regional authorities and between local and regional. I leave the state behind, but I think we have learned that even if we feel strong, even if we feel that we could solve a lot of problems, there is good to have friends, and we have more friends around us than we have over us. Thank you.
Thank you, Anders. And James, you have the last wish for 2021 for local governments.
Well, this is the same wish I have every year for local governments around the world. Local governments in most countries need adequate powers and resources, adequate powers and funds, which they don't have. They have these things in Sweden. They don't have these things in most countries. If you give them powers and resources, they will deliver benefits in dealing with COVID and in dealing with many other things, including inequality and vulnerability. Trust them. That's my wish.
So thank you all for joining us 3 minutes over 3. It was a pleasure to have you all here. Thank you to our panelists, to Emilia, Anders, Imen, and James for doing such an excellent job in reflecting on these questions. Thank you to our wonderful audience. More than 100 people joined us today, and they gave us so many interesting questions. We look forward to keep connected in cities are listening at the Swedish International Center for Local Democracy. Thank you.
Good job, Ana Maria. Thank you very much.
Thank you. Bye-bye.
Merci,
Thank you.
merci, au revoir.
Merci. Au revoir.
Thank you all. Thank you.